Have you done low FODMAP, and how well has that worked, or other dietary changes?
Yeah, the low FODMAP diet is almost the gold standard when it comes to treating IBS. And by the way, over 50% of patients do respond to the low FODMAP diet, right? But that also means 50% do not respond, right? And the low FODMAP diet, the problem with it ends up being that it's more of a blunt instrument, right? So if you have a little leak in the pipe, instead of trying to find out what that little leak is, a lot of times we're just breaking down that wall. And so these patients are avoiding whole groups of foods, dairy and wheat, and that sometimes leads to nutritional deficiencies even. So with a low FODMAP diet, you really need the help of a GI dietitian to be able to make sure that you're doing it appropriately. There are 3 phases where you eliminate like 120 foods, then you introduce 1 food at a time. So even if you do it correctly to try to pinpoint exactly the food trigger, it's going to take you months. And patients are rightfully so, have a hard time complying with this kind of a process. It's very restrictive. So that's, I think, the major issue with the low